One, a neonate born at 28 weeks gestation is exhibiting signs of respiratory distress syndrome, RDS. Which intervention should be prioritized immediately after delivery? A. Initiate chest compressions. B. Administer surfactant therapy. C. Begin phototherapy. D. Start intravenous antibiotics. 2. When assessing a preterm infant for intraventricular hemorrhage, IVH, which clinical sign would be most concerning? A. Intermittent tremors. B. Sudden drop in hematocrit with bulging fontanelle. C. Mild temperature instability. D. Occasional apneic episodes. 3. A 32-week gestational age infant is receiving caffeine citrate for apnea of prematurity. Which side effect requires immediate intervention? A. Mild tachycardia, heart rate 170 BPM. B. Increased urine output. C. Cardiac arrhythmia. Mild jitteriness. 4. What is the most appropriate method to assess pain in a 26-week preterm neonate? A. Crying intensity only. B. Cries pain scale. C. Premature infant pain profile. D. Visual analog scale. 5. A term infant is diagnosed with persistent pulmonary hypertension of the newborn, PPHN. Which treatment modality is most effective? A. High-frequency oscillatory ventilation only. B. Inhaled nitric oxide therapy. C. Immediate extracorporeal membrane oxygenation, EMO. D. Increased ambient oxygen without mechanical support. 6. When caring for an infant with necrotizing enterocolitis, which assessment finding indicates the condition is worsening? A. Decreased gastric residuals. B. Abdominal distension with visible bowel loops and absent bowel sounds. C. Normal white blood cell count. D. Increased appetite. 7. A neonate is being treated for hyperbilirubinemia with phototherapy. Which action is essential for preventing complications? A. Covering the infant completely with blankets. B. Keeping eye shields in place and monitoring temperature. C. Feeding every 4 to 5 hours. D. Limiting fluid intake. 8. What is the appropriate fluid management strategy for an extremely low birth weight, EW, infant in the first 24 hours of life? A. Aggressive fluid administration at 150 ml top day. B. Restricted fluids starting at 60-80 ml per kilogram day with careful monitoring. C. Standard maintenance fluids at 120 ml kilo day. D. No fluid restriction regardless of urine output. 9. A preterm infant develops bronchopulmonary dysplasia, BPD. Which long-term intervention is most appropriate? A. Immediate cessation of all respiratory support. B. Gradual weaning of oxygen with nutritional optimization and diuretic therapy. C. Continuous high-flow oxygen without weaning. D. Prolonged mechanical ventilation without attempting extubation. 10. When performing endotracheal suctioning on a ventilated neonate, what is the maximum recommended suction duration? A. 20-25 seconds. B. 15 seconds. C. 5-10 seconds. D. 30 seconds. 11. A newborn presents with cyanosis that does not improve with oxygen administration. Which congenital heart defect should be suspected first? A. Ventricular septal VSD. B. Patent ductus arteriosus. C. Transposition of the great arteries, TGA. Atrial septal defect. 12. What is the primary goal of developmental care in the NICU setting? A. Maximizing stimulation to promote growth. B. Minimizing stress and supporting neurodevelopmental outcomes. C. Maintaining strict feeding schedules. D. Limiting parental involvement. A neonate with hypoglycemia has a blood glucose level of 35 milligrams to Dorellis. What is the most appropriate initial intervention? A. Continue monitoring without intervention. B. Administer IV dextrose bolus followed by continuous infusion. C. Feed orally and recheck in 4 hours. D. Administer glucagon injection. 14. When assessing for patent ductus arteriosus PDA in a preterm infant, which clinical finding is most indicative? A. Continuous machine-like murmur and bounding pulses. Cyanosis with feeding. C. Decreased urine output only. Bradycardia. 15. A term infant is experiencing neonatal abstinence syndrome, NS. Which pharmacological intervention is first-line treatment? Phenobarbital. B. Morphine or methadone. Clonidine alone. Diazepines. 16. What is the correct procedure for umbilical venous catheter, UVC placement depth in a newborn? A. Insert until blood return, then advance 2 to 3 centimeter. B. Calculate based on shoulder umbilicus distance. Tip should be above diaphragm. C. Insert to 10 centimeters regardless of infant size. D. Place tip in inferior vena cava below the liver. 17. A preterm infant requires total parenteral nutrition, TPN. What is the maximum safe rate of glucose infusion to prevent hyperglycemia? A. 4-6 mg initially, advancing as tolerated. B. 12-14 mg kilo min from start. C. 15-18 mg immediately. D. 2 mg maximum at all times. 18. When managing retinopathy of prematurity, pre-screening, at what postmenstrual age should the first examination occur for an infant born at 26 weeks? A. At discharge. B. 31 weeks postmenstrual age or 4 to 6 weeks chronological age. C. 40 weeks postmenstrual age. D. Immediately after birth. 19. A neonate is suspected of having congenital diaphragmatic hernia, CDH. Which intervention should be avoided? A. Endotracheal intubation. B. Bag mask ventilation. C. Nasogastric tube insertion. Intravenous access. 20. What is the appropriate dosage range for surfactant administration in a neonate with RDS? EDS MQ. B. 50-100 kU. C. 100-200 mg per kg, typically given as poractant alpha 100 to 200 mg per kg or biractant 100 mg per kilogram. D. 300-400 grams per kg. 21. A preterm infant exhibits signs of late-onset sepsis. Which organism is most commonly responsible? A. Group B Streptococcus. B. Coagulase-negative Staphylococcus coans. C. Listeria monocytogenes. D. Herpes simplex virus. 22. When providing family-centered developmental care, which practice is most evidence-based? A. Restricting parent visitation to specific hours. B. Encouraging kangaroo care and parental involvement in daily care. C. Minimizing parent-infant contact to reduce infection risk. D. Limiting parents to observation only. 23. A term infant presents with seizures at 12 hours of life. After glucose and electrolytes are normalized, what is the most likely diagnosis? A. Intraventricular hemorrhage. Hypoxic ischemic encephalopathy. C. Congenital infection. D. Metabolic disorder. 24. What is the target oxygen saturation range for a preterm infant less than 32 weeks gestation receiving supplemental oxygen? A. 9,500%. B. 88 to 95%. C. 90 to 95%. D. 85 to 89%. 25. A neonate requires chest compressions. What is the correct compression to ventilation ratio? A. 15 to 2. B. 30 to 2. C. 3 to 1. D. 5 to 1. 26. When administering medications via umbilical arterial catheter, UAC, which position is preferred for catheter tip placement? A. High position T6, T9 or low position L3, L4. B. At the level of the renal arteries. C. In the descending aorta at T12. D. In the abdominal aorta at L1. 27. A preterm infant's parent asks about the purpose of minimal enteral nutrition, trophic feeds. What is the best explanation? A. To provide complete nutrition immediately. B. To stimulate gut maturation and hormone release while preventing atrophy. C. To replace parenteral nutrition entirely. D. To increase weight gain rapidly. 28. What is the primary indication for therapeutic hypothermia in a term neonate? A. Suspected sepsis. B. Moderate to severe hypoxic ischemic encephalopathy. C. Respiratory distress syndrome. Hyperbilirubinemia. 29. A neonate with gastroschisis requires immediate intervention. Which action takes priority? A. Oral feeding to maintain gut function. B. Covering exposed bowel with sterile saline-soaked gauze and plastic wrap. C. Immediate surgical repair without stabilization. D. Placing infant in supine position. 30. When calculating maintenance fluid requirements for a term newborn on day 2 of life, what is the appropriate starting rate? A. 60-80 dap per day. B. 100 to 120 milliliter per day. C. 460 per day. D. 180 to 200 ml per day. 31. A preterm infant develops thrombocytopenia with a platelet count of 45,000 mm. At what threshold should platelet transfusion be considered in a stable infant? A. Less than 100,000 per mm3. B. Less than 75,000 mm3. C. Less than 50,000 mm3. D. Less than 25,000 mm3. 32. What is the correct technique for performing heel stick blood sampling in a neonate? A. Stick the center of the heel. B. Stick the posterior curvature of the heel. C. Stick the medial or lateral aspect of the plantar surface of the heel. D. Stick the arch of the foot. 33. A neonate born to a mother with chorioamnionitis requires evaluation for early onset sepsis. Which laboratory value is most sensitive for detecting neonatal infection within the first 6 to 12 hours? A. C-reactive protein. B. Complete blood count CBC with differential. Blood culture. Calcitonin.